So how to manage a priapism? So a priapism is considered a priapism if a man has an erection for 2 hours and it is rock hard. It is actually quite painful. So the reason why it could happen is because a man starts an injection process. If the injection is done, the first dose could cause a priapism. So when we do this, we try and go to the lowest dose possible. The other time it could probably happen is if you overdose. So if you inject too much, or if you try and top up even though you've got an erection already, or you do more than one injection in 24 hours. The other time it might happen is if you try and take a Viagra or a Cialis tablet with the injection, it's not going to make it harder. It's actually going to make it last too long. And the most common one is if a man has had a radical prostatectomy for prostate cancer or radiation treatment, and suddenly the nerves are waking up, and so they're starting to interfere with the medication. This is often quite exciting for the man because they're starting to get a bit more nerve activity, but as soon as this starts to happen, we need to pull back on the medication or stop the injections completely. So what do you do if you've got a prolonged erection for 2 hours? The first thing you need to do is try and relax and take 2 pseudoephedrine tablets. Now, Sudafed works by unblocking your nose. It also works by unblocking your penis. You then need to go for a run or a jog or run up and down the stairs because physical activity gets the blood vessels to dilate. You then come back, have a hot shower, and then grab an ice pack and wrap the ice pack around the shaft. And try and relax as much as you can. If it doesn't start to subside within about 30 minutes to 1 hour, you need to repeat the process again. If you're running into trouble where you're sitting there for 4 hours and the erection is still super rock hard, you need to call your practitioner who's looking after you, or you need to go to the emergency department. Do not leave it. Don't wait until the next morning. You need to get it sorted.